don't want to either get the exposure or I don't want to have to worry about staying on with the work and the work type. The second thing that went on was what I call the nursing economy. The clinical labor economy really shifted with focus on hotspots or pandemics and exorbitant travel rates that cause. And the bottom line for most places, whether it's all the way from home health is where our hospices we've talked about in the outpatient setting to hospitals, is you've had an erosion of your core staff available. So when we staffed pre-pandemic in the 95% range with core staffing, we may be lucky to be in the high 70s right now. And that's put a lot of stress on flexible labor pools to allow us to cover the demand side. So the things that we've had to do is we've done, number one, as Dr. Laney said in his talk, number one is really push hard on retention. And there's tremendous pressure right now with respect to the reasons not to be retained, and I mentioned some of those. The second thing is, on the recruitment side, we've gone all the way from helping create a new access through working directly with high schools and trying to get exposure to the different areas. And one of the things that we may have, while there are entry levels that don't require college education in healthcare, there are pathways that we've structured to allow them to see themselves career pathing within our system. We've done other things also, which is as much as on one side, and you and I talked briefly about this in the area before, in the lounge area before, was, you're looking at we've had the folks that left more are probably those with more tenured. So how do we then look at bringing in younger people? We've started nursing schools. We're working directly with the academic places around here. We've done some non-traditional recruiting, which is to look in the cold states. Who wouldn't want to live in Tampa in Florida, right? And so that's a great thing that we can do. We've got graduate education programs out there, and I think that the one thing that I would say that we've done in addition to that is we've gone back to those people that have left. We call it our boomerang campaign. Come on back, let's see if we can re-enter. The same pressures that were outlined in the talk before, childbearing age, considerations, lifestyle, are things that we are then modifying how they look at work now and supporting them. So those are the non-traditional things that we've done that we didn't have to do pre-pandemic.
Okay. Awesome. Bill?
Yeah, I think Dr. Laney said it, hiring more broadly. I mean, I love that term because that's what I think we all have to do, is hire more broadly. And, for us, that's where we're looking, programs internally, like our Pathways program, to work with low to moderate income communities and bring in folks that may have been told they can't come work for a financial institution. Then you have programs like Year Up, 110, the ACE program. All these, you put them all together, and there's opportunities with each of these. And so that's kind of the external part as you do it. But internally, you have to tell what you do. I mean, I don't assume that everybody actually knows what you do with your company.
With like, I go to my smartphone and that's how I do my banking.
Right.
Like, is it harder to get people to imagine banking and finance as a career? Because we don't see it anymore, right?
Yeah, I think so. If you think about what is a traditional, what you thought was a bank, and it was a brick and mortar building with people there, that's probably 20% of our population in Tampa Bay. Yeah. Our largest area of employee population, if you look at the group that they fall into, it's tech and ops. Yeah. So when you think about, we're a technology company as much as we are a financial services company, and we have to tell that story because we have jobs in marketing, we have jobs in legal, we have jobs in social media. We have all those things that maybe historically somebody hasn't necessarily thought of as being part of a financial institution. And so you have to tell the story about what those opportunities are, entry level, and through that career. And I don't think, and the narrative's changing, and it's changing. What we've all seen in the last 24 months certainly is just changing even faster. And that's, you have to be on top of that.
Chief, I want to come back and ask, Ravi brought up frontline workers. You really are the front line and the people that work for you. Are you seeing the burnout issues? Are you seeing a reluctance for people to think about what you do, to consider that first responder, fire as a career?
So as far as coming and being the front line, over this last 2 years, we have seen our staff being affected. So basically, we had to, in order for the city to perform on a daily basis as far as operation, we have to keep a minimum staff number. So if personnel are being affected, now we have to mandatory. So when you mandatory someone, they just finished a 24-hour shift. Now you're on a mandatory mean to do another 24-hour shift. They do get burnt out. So now we see an increase of people calling out because I don't want to get mandatory. I'm tired of working. So something that we have, or since I've been in this position, is trying to keep from mandatory. We're still going to hire overtime, but we want you to volunteer for it, okay, until we can get this COVID situated. So right now, my goal is to keep us from getting mandatory because it does burn you out 24 hours and running, you know, anywhere between 10 to 15 calls, constantly being exposed to the unknown and actually transporting, going to the hospital and being exposed more, you know. So we make sure we keep up with our PPE that we have for the personnel so they don't, you know, to reduce the exposure. But that front line has been affected like the healthcare is. Fortunately that we do have 2 days off because of our work schedule, so which has been great. So if I can decrease the mandatory for now, give them 2 days to rest and just pray they show up the next day. You know, the third day.
Yeah.
You know, it's better, but these last 2 years has really taken a toll on the frontline workers.
So,
Are you finding a compressed training time? I mean, has that frontline staff had to learn more faster than it's ever had to do before?
Yes, because we was actually dealing with COVID before people knew what COVID was. So we didn't know what we was being, you know, exposed to, you know, without the normal PPE. Even though we have a protocol that says, you know, to wear your personal protective equipment, certain things, but if you get a call and the person say, oh, I'm just having pains on my sides or ache, you know, not knowing that that is one of the symptoms of COVID, once you assess the person and realizes, you know, they are having other symptoms, now you done pretty much expose yourself, you know. So even with the healthcare, with CDC changing some of the guidelines of healthcare workers basically trying to get us back out there, and of course the hospital experienced that too, just because you've been exposed and you don't have it, we still want you to come to work, you know. But I'm now taking a chance to expose my family. So if nobody's there to take care of my family, now I got to call out. So it's just a whole big system that, you know, us frontline is looking into to try to make it better. But we are being affected, but it's better. And like I said, my goal right now is to keep that moral up from individuals being mandatory overtime, because 24 hours is a long time.
so interesting. So Randall, I don't know if any industry or of any industry that's been more directly impacted by COVID than yours. You know, where there is not so much of an opportunity to do things remotely, or how do you guys stay in business? You have to have people to operate hotels, you have to have people to operate grocery stores, that whole leisure, hospitality, retail chain. So talk about some of your challenges and what are you doing? I mean, I talk to Ben all the time about it, but interesting to hear it from you as, you know, how are you meeting some of those challenges? How are you getting enough people to be able to get your occupancy rates up or to get your RevPAR rate to where you need it to be to continue to operate? So I'm interested to hear
It
your
is
strategy.
challenging, as you stated. Our staffing levels are dependent upon our occupancy. When COVID, the pandemic hit in March of 2020, in Florida, we went from 90% occupancy to practically 9%, and it was overnight within 2 weeks. So company-wide, we were about 2,500 employees. We went down to less than 500. So we've built that back up, thankfully. Certainly with Ben's leadership and help, we're just shy of 2,500, but we have more hotels that we manage. So we don't have the number of associates per hotel count that we had before. RevPAR numbers are close to where they were in 2019, very short, and it's been a stair-step approach every month, and we're still not where we were with business transient is not there. A lot of offices are not back to full capacity, conventions, large groups, but as the leisure markets have led the recharge, so we're thankful for that. And so we're the biggest shift we've had in hospitality from pre-pandemic to that. We were short-staffed prior to, it was difficult to find people, as Dr. Laney indicated, that unemployment was so low. But the biggest shift we've had is we were isolated where we used staffing agencies and temporary labor and contract labor, and now a lot of markets that has become the norm. So we're contracting a lot of the back of the house associates, and we prefer for our associates to be on our payroll and our benefits and our tenure, have a career that path that they can follow. But push comes to shove. And lastly, we really I hate to do this, but it's the norm. You see it at restaurants where tables are sitting empty. We have rooms that sit empty because we just do not have the staff to clean them. And if we're pushing our leaders to make sure to rent every room every night that's available, they're going to get burned out. And so it's difficult to do that.
Yeah.
So that's the very last resort, but it's the reality.
Gotcha.
Randall, one of the things, talking with Chef Jeff last night, talking about we've seen wages rise about 4.7% in the last year alone. That's starting to impact your industry. I mean, I know I'm the only one in my family not in healthcare, so when we talk about staffing, I understand the cost that adds on to that. What's that mean? What do we as the consumer need to be prepared for? How is your industry coping with these rising wages?
We certainly strive to not have any impact on the guest's experience and the guest stay. Technology does help. A lot of, if you're a Marriott Rewards member, a Hilton Honors member, you'll can opt for digital check-in and digital key. You can bypass the front desk. So as long as people are utilizing this technology, we can have less desk staff. If you're utilizing the app for requests, towels to your room and things, we can have less personnel on phones and in housekeeping. So, pre-pandemic, we cleaned every room every day. And for safety reasons, we weren't cleaning occupied rooms during the pandemic, and a lot of hotels have not gone back to full service cleaning every single day. So that has changed. The model's changed a little bit. But we've had some cost savings there, but it's been absorbed by wage increases. We're seeing the same things as Chipotle and Frontline Retail. We had to increase wages in some markets, 30, 35, 40, even 40%. And then that pushes everything up because you certainly want to pay everybody equitably.
So for those of us who clean our apartments every day, make our beds every day, change our towels every day, we're going to have to get used to a little lesser quality of service when we travel. Is that
there's certainly talk in the industry for how do we they're having an upcharge for housekeeping if you wanted service every day. So you could, just as the airlines thought, we all thought it was crazy that they were going to start charging for baggage, and they did, and now it's a norm. Whether or not the industry will go to that, I don't know. But if it does, it could. You may have to clean your own room and reuse your towels. We do encourage people to reuse their own towels.
You get 500 points every time you do it.
Yeah, you can bypass and earn
right.
points. There's ways.
Brian, in this new world, your industry in communications has just changed like night and day. We recently hired a new communications director. He's fresh out of college. I have no idea what he's talking about half the time. What are you seeing in your industry? And then in terms of the employer, how do you suggest the employer talk about people coming back or people staying in an industry or thinking about industries? What's going on with you guys?
I probably wouldn't know what your young 21-year-old employee was talking about either, so don't feel bad, because things are changing very, very fast. And I'm very fortunate that both in our company and our client base, we get to see this across a wide spectrum of services, from the pains Jonathan talks about to the pains that Dr. Sherry talks about to what Roy's talking about. We get to talk and engage with these clients, and what you're talking about, we represent the National Organization of Black Law Enforcement across the country. So this is a constant with us talking about labor issues. Yeah. This is a constant with us talking about recruiting issues. This is a constant for our clients talking about these issues, and it's a constant for ourselves. And it is a matter of how do you use the integration of technology today, user experience that you talked about, and provide people with some of the things that our speaker talked about.
Yeah.
And when you step back from it, it actually presents some opportunities occasionally to do something different and unique. And every case is different. So where it was just easy to make decisions across the board several years ago, it's really not.
Yeah.
You have to look at what's the problem you are trying to solve in your organization, step back from that and think about it from that context. And sometimes things just, you realize that you could do something different. But our generation likes to do things the way we've always
Yeah.
done it. And we'd rather complain about the younger generation that wants to come in and disrupt everything. Well, COVID disrupted it for us, so
Chris talked about retention, and a friend of mine is in HR, and she was mentioning to me that her mantra is if she's not recruiting her employees every single day, she's the only business not recruiting her employees.
Yeah.
Are you seeing business, your clients talking more about how do they talk to their employees and people in their industry to keep them excited, to keep them engaged?
Yeah, absolutely, all the time. I mean, your best recruiter are your employees.
Yeah.
So if they're not having a good experience in the company, they're not going to be your employees, so you're losing your recruiting force. So you got to think about it from that context often. I mean, even our company, we provide a larger referral to our own employees for bringing in talent. And I announced that last December because I know our great team members, and we have about 120 of them, they know people that be great team members at Vistra, much better than my recruiter could ever find. They have family members, they have friends, they're in circles that we're not in, and we encourage our clients to think about it from a different context than they did several years ago.
So you talked a lot about what you do for your customers, your clients. How are you cultivating your own workforce? Where are you finding, how are you thinking about how am I gonna continually fill my pipeline? Because you do kind of step into the IT field too, and it's an attractive, it's kind of like the sexy thing for kids to do. But even in Tampa, where you get all these people coming in every year, and Craig, we'll talk about this in a minute, there's still disconnect. There's still tons of open jobs and not enough people to fill them, whether it's because there's no interest there, they don't feel that the skill set that they have equates to a successful transition into that industry. So I'm interested to see, for your own company, Brian, how are you managing that?
For us, it starts with our culture.
Okay.
We want people to know we're a small business with great culture, and you're missing out if you don't want to be a part of that. And we have to talk about that in lots of different ways so that the receiver hears that, and we're not just talking.
Gotcha.
So that's a big part of it. The other part of it, I mean, we're constantly recruiting. We had 2 new people on board this morning. Awesome. Literally right here in our Tampa office, not to mention other places we have talent across the country. But we're constantly recruiting. But we sometimes we share great positive things that happen in our company because we want people to want to be a part of it.
Yeah.
So we share successes. We share, because we're always looking for great talent, just like all the rest of us.
Sure.
Craig, the economic development, the pandemic had to have an impact on you and on your industry. Are you sensing or are you getting a change in the conversation that companies have that want to stay here and expand, or companies that want to come to Tampa? Are there different questions they ask today than maybe they did 3 years ago?
When you look at the types of companies that we're seeing more of now, it's the types of companies that employ remote workers, which wasn't a conversation, 4 or 5 years ago. Today, 4 or 5 years ago, people were looking at the local labor shed as, where can I draw my workers from? Where can I draw the talent from? Today, they're looking at super regional markets to where they draw their market from. Where before, companies, when they hired someone, they expected people to come in 5 days a week, 8 to 5 or 9 to 5 or whatever the case may be. Now it's like, okay, well, if you could come in once every 2 weeks from a 4-hour drive or 2-hour drive, then that's a lot different than what it was just 5 years ago. And so the kind of conversations that we're having with companies now is based upon, explaining more of a super regional labor shed versus just a local labor shed. And that's one of the key
Does that
differences
put
that
more
we're seeing.
pressure on you? I was just reading a couple days ago, a fascinating article, and it's something that I had mentioned one of your good friends and one of mine, mutual good friends, and we had that conversation about every time you put in a new ramp to the expressway or you added a stop to your light rail, you watch that commute pattern move out. Does that put more pressure on you, this region, in terms of the infrastructure that's out in the outer part? Broadband has to be a bigger issue, or something that's in your sights today than it was.
Yeah, technology infrastructure is going to be the key to any community's growth now. As most urban planners know, urban cities, first developed around seaports, and then later roadways, and then airports. Now it's technology. So if you don't have the technology to support commerce and industry, then you're going to be behind in the competitive location conversation. What's also important is that, we're fortunate here in Tampa in that we've been a big draw for talent, for quite some time before the pandemic. The pandemic actually accelerated it. What we've seen is strong in-migration patterns now from the East Coast and the Midwest. And when you look at our in-migration patterns, they're primarily coming from New York, and they're coming from Chicago.
Yeah, I was just there, and I understand why.
Oh, yeah, and so, I bet you do, especially now with the weather the way it is. And Atlanta is a big feeder market for ours. Yeah.
Is it changing are the conversations in your industry changing about what the center city looks like? Because in DC, where our offices are in downtown DC,
Right.
pretty hard to find a deli that's open for lunch.
Yep. So in the world of economic development, everybody knows this is just business recruitment, The
I know,
reality
you guys
is,
cut ribbons.
yeah.
Really?
No, economic developers don't cut ribbons. We actually bring the companies in and let our elected officials cut the ribbons.
Yes.
That's what we do. But in terms of how the dynamic has changed in the field of economic development, the primary concentration used to be just recruitment, retention of your local businesses. Now it's shifted to how can we attract the talent that's needed for our local businesses, to now, how can we make sure we have the type of place that will retain the talent that will attract the businesses. So it's a different conversation, if you will, now.
I want to talk a little bit about remote. Ravi, how has, I mentioned I'm the only one not in healthcare. My brother-in-law's a doctor. Telemedicine, when the pandemic started, he just was like, save me. But now he's like really into telemedicine. How has the remote worker or the remote healthcare changed the industry? And is this something that you mentioned we're in a period of transition? Is this something we're going to see a lot more of?
I think the most important part about telemedicine through the pandemic was the provision for the providers to be paid. And it created a way to accelerate that because it added value to their workflow. The interesting thing about it, when you really start looking at the numbers underneath it, is there's no doubt that we saw a tremendous rise in the number of people who were using that, I mean patients and physicians, when we had the lockdown. As the lockdown abated, so did the frequency of telemedicine. And while it continues, and we're real strong advocates when we meet with our politician friends up in DC to continue to ask them to keep that mechanism of payment, because I believe it's going to find probably an equilibrium, but it certainly presented itself as a new option to accelerate management of patients remotely. For the right patient, it's an absolute great mechanism. I think as we move to wellness, I think as we look to population management, it's going to be indispensable, and that's how it's declared itself. There are other ways that you're starting to see it come through now in call centers and ways in which other panels are looking. So you'll find industries where there are systems in the industry where they've set up the ability to say urgent care at home, ER at home, even skilled nursing facility at home and hospice at home. These people now have been able to introduce that as a mechanism to avoid the hospital entirely. So how it all shakes out, not clear, no doubt. It accelerated the progression of that into the healthcare workflow, and it'll continue to refine itself. Now, flip it around another way. There were, as we worked through that, no doubt about it, part of healthcare is the physical presence and physical touch. So it's not going to be a substitute for those cases, and this is what we found. I think we're better now. We found early it created what I would call healthcare avoidance. Because I had this, but I couldn't get a full assessment, maybe I would avoid. Maybe I could get a medication prescribed to me versus actually having an intervention. I think we're resolving some of that, so it's not going to be as broad in that way, and it'll pull back. And those patients there's a group of patients who definitely need to have in-person care, and telemedicine is not a substitute.
Do you see more pressure on the two of them to produce technology workers
Absolutely.
and technology capacity?
Absolutely. There is a real component of how we now look at it, all the way from recruitment and social media presence to communicating to our staff in multiple different channels, different ways that they want to be part of our system that we can interact and engage with. So technology, that part of it, even engaging our team, that digital component and digital presence for our patients, that's become even more pronounced. And again, that's a positive outcome because it's forced us to get better faster.
I was going to ask follow up the same thing. Bill, do you find that in some ways there's a built-in kind of expansion of who could be interested in finance, because technology is a big part of that. So if I don't care a hoot about finance, technology could grab me into your industry, right?
Yeah, and I think it goes back to telling the story. And Dr. Laney also had the graph up there talk about wages and onboarding, kind of at the continuum and the end of it. And wages are, you got to pay. I mean, that's just the reality of it. And
we hope.
We hope. I mean, and we've moved our minimum wage is now $21 an hour. It'll be $25 an hour by the year 2025. And that is reflective of the spectrum of opportunities at the bank. But also onboarding. And I think we sometimes forget about that, and especially a generation coming in now that can go to a computer. They can go to the Apple store, and I can walk out with a MacBook, and it's up and running in 45 minutes, and I've connected everything. I can't take 2 weeks to get your computer working and get you connected to emails. That just doesn't work any longer. And everything in between there is about purpose. How do you talk about the purpose of what your company does, and what's that your company's commitment to diversity, commitment to the environment, commitment to the community? And that's to Brian's point. It's the whole piece about your best recruiters come from within. They can tell a story to all their friends and colleagues and neighbors that not anybody else can do. And so I think that's a big piece of it. And then Craig was talking about the remote piece. 60 Minutes last night, I don't know if anybody saw it, Karen Kimbrough, who's the chief economist for LinkedIn. It's well worth the 15 minutes if you haven't seen it. But she's talking about how pre-pandemic, 1 in 67 jobs had a remote workforce capability. Post-pandemic, 1 in 7.
Wow.
And so you think about that. I'm not traditionally what you would define as a work remote type company, but there's work remotely opportunities, and we just have to make sure people understand that.
So interesting, you point at Craig and I about technology. So one of the things from a workforce development standpoint we've done is we've had to invest in what platform can we utilize, or is there a platform we can utilize to get people who traditionally have a barrier to getting into one of our centers, and moving that out into the community. So we've done that. We work with a company called Career Team through a product called Career Edge. Last year we served about 32,000 people. 8,000 of those were from our online interface. That's 8,000 people that probably were never going to walk into a career center, and that might be 8,000 people that we'll be able to present to all of you as talent options in the future. So for us, it's critically important. The time to divest a little bit from brick and mortar is here and utilizing technology. It's 1.5 million people here. Our labor force is 800,000. We can't possibly serve all of them if they need to be served walking into our centers. So how do we figure out a way to better utilize technology? we're doing it to the point now, even for services where we do like an OJT or an intensive service, to be able to do that all online. And we understand that we're no longer going to be able to, or the need isn't going to be just for everybody to walk into our centers, whether at one center or whether we're more community focused, which we've done too. But I mean, 8,000 new people, in a year is significant, particularly if we're talking about, plugging holes in the talent pipeline across industry. So that's just how we've done it. And I'm sure Craig has some, Craig talked about placemaking a little bit, and I think that is part of how you do that as well. I just wanted to get that. I mean, it's pervasive in every industry now.
I want to come back to Jonathan and Roy, because your industries that we typically don't necessarily associate with automation, but we know in looking, my friends over at A3 who track automation tell me that last year was probably a record year in terms of the purchase of robotics and automation and the deployment. How critical is that to you, Roy, and how critical is it that young people understand how to work with technology?
I think that, more and more we're having to go to automation and technology because of the shortage of people. In 2019, we got a contract that was a pretty high volume contract for a number of parts for the 737 MAX. So we spent $2 million on machine tools and a robot, and then they grounded it, and so that didn't help us much, but it is now starting to come back, and so we are utilizing a robot for the first time. And as the newer people come in, they need to be able to integrate and work with the computers, and there's more artificial intelligence being built into the machine controls and things like that. So it's critically important that people learn that.
Bill mentioned onboarding. Has that changed for you when you bring somebody in? Are they surprised by the technology? Is it something that you've got to ramp up quickly?
More so than we've had to before. Especially with the younger people, their attention span isn't that great, so they don't want to spend hours and hours changing parts on a machine as they slowly develop their skills. So yeah, we have to bring along a lot faster. And of course, they go to Facebook and watch machining videos, and they think they know it all in a few weeks. But
yeah, I recently watched YouTube to learn how to do some plumbing. Fortunately, the plumber got there pretty quick after I exercised my talents and got everything straightened around. Jonathan, again, you're in industry. I don't necessarily think I can hang out at home and do construction. What's happening with technology for you all, and how has that impacted your recruitment?
So two things. First thing is we don't do a lot of automation, but we do have to have technology now. Everybody on the site has an iPad, or in a supervisory position has an iPad, so you have to understand what happens with that iPad. How do you keep records with that iPad? How do you get your plans in there so you can see the plans and make adjustments with an iPad? So there is technology that is included completely with our industry now. You have to have it for safety, for everything. Everything automatically goes back into our data ports, both in the office and with the owner. The owner can now see what's going on their sites immediately. There is technology with the cameras that we use that are on site and things like that. So that's one thing. The other thing that I'm very proud about with our company is the fact that 60% of our people, we've retained them for over 20 years.
Wow.
And so,
how have you achieved that?
well, I think since it's not me, it's the team. It's our team that we have. I have my chief strategy officer, which in construction you don't think about a chief strategy officer, but we need that because of all the things that are being talked about today. There has to be a strategy for everything that we do. And one of the other things that you wouldn't think about in my particular industry is my particular industry was dominated and is dominated by white males. construction. But all of my leadership is either Hispanic or Black females, which is different.
Oh, wow.
And what that does is brings a different perspective about strategy that we wouldn't think about. So I am constantly getting information about how we should be thinking, what we should be moving towards, how do we do recruiting, what areas, whether it be that we need to be looking at to bring people in, to teach people, to do different things like that. And so I think that has helped our company both retain and also listening, just like but Brian mentioned, you know, listening to our people in our office